Well, we are going to get started this morning at our 12th annual Call on Congress Hill briefing here. It is the last stop, but not the last event for our Coast to Coast event, or Coast to Coast campaign for 80% by 2018 and beyond, really, at this point. We're really excited about that. And I've asked my colleague, one of my favorite colleagues in the world, actually, from the National Colorectal Cancer Roundtable to share a few words as we welcome everybody to their Hill Day, which we're so excited about.
Well, thank you so much. What an amazing turnout and such good energy in the room. I always love coming to this event every year. Anjee came to us a few several months ago, about doing this coast-to-coast event where we were in LA 2 weeks ago, in DC this week, and I was like, you are crazy. But it turned out amazing, and it's so important. We just need to keep telling our stories. I mean, you guys have so much to say, and you have an authenticity that none of the rest of us have, and people need to hear that. So from the bottom of my heart, thank you so much for coming. Keep doing what you're doing, and have a great day today.
Thank you. Mary is the spearhead and the machine behind 80%. So we're so glad that she's a champion on our behalf every day of the year. So our first guest is Congressman Rowe. He represents the 1st Congressional District of Tennessee. He's a resident. Woo! Go Tennessee! Go Tennessee! A resident of Johnson City, serving his 5th term in Congress, has a strong work ethic and is committed to working on behalf of his 5th district and on behalf of colorectal cancer survivors. We are honored to have him as a part of our Congressional Advisory Committee. Thank you for joining us this morning.
Thank you all for being here. And listen, we're in the U.S. Congress that has a less than 10% approval rating, so I'm glad to get invited anywhere. Thank you. There are actually 3 things that poll worse than we do: Lindsay Lohan, meth labs, and North Korea. So that's kind of where we are as a congressman. No, as she said, I'm a physician, and I hate to believe it, to admit it, but I will have graduated from medical school this year 48 years ago, so a long time, and I'm an OBGYN doctor by training, and in Johnson City, Tennessee, was on the medical faculty of our medical school and in private practice at the same time, and about 10 years ago went off my medication, and look what happened. I ended up in the U.S. Congress. So anyway, I do appreciate what you all are doing, to see this room full of people, and I will share my story with you, and then thank you for being here. At about age 50, my dad had a polyp, and so I had colonoscopy and had flexed cigs prior to that time, and I had a tubular adenoma, so I had a precancerous polyp, and I've been followed up regularly since that time. And I can now talk about this. I couldn't for a long time, but a little over 3 years ago, my wife was diagnosed with colon cancer and died 5 weeks to the day after she was operated on. So it's difficult for me to this day still to talk about it, but it is very important for you all what you're doing. You are out here, as I went to the operating room many times and saved a life. You can save a life by what you're doing. And I have a friend now, a very, very dear friend of mine at home, who has, for 39 years, has called every Elizabethan basketball game and football game. And by the way, you all don't know where that is, but there's a tight end that plays for the Dallas Cowboys, Jason Witten, who's going to be in the Hall of Fame, who is from Elizabethton, Tennessee. And he called all of Jason's game. He is now stage 4 colon cancer and is on chemotherapy right now. So keep my friend John Holzclaw in your prayers. A great guy. You hear this story. You all know this story. So go out and share those stories with the people that you're going, the congressmen and women you're going to see today. And then there's some really good news. We know the incidence is about as great for women as it is men. We know as you get older, you all know the statistics, a little higher for African Americans in certain groups of people. But getting people to get screened, getting that done is the single most important thing you can do, I think, and convince people to have it done. Look, I mean, you don't wake up one morning and say, oh gosh, I'm really happy that I get to drink a gallon of Go Lightly and go have that done. So I know when I start thinking, when that date comes, I keep dreading it, dreading it because I've done it before. I do look forward to the propofol, though. So that part, that's okay. Anyway, the opportunity you all have to change a life, to help people advocate is, I can't thank you enough for taking the time away on this beautiful spring day to be here in Washington and to go to the offices. And lastly, I want to finish out is because look, colon cancer is not Republican or Democrat. It's about people, and that's what it's about. And we, 2 years ago, passed the 21st Century Cures Bill, as you know. And that added $2 billion to the NIH, additional money to the NIH. In this omnibus that we're going to pass, when we can finally get some agreement on it, it's going to be $3 billion more for them. That's both for Alzheimer's, cancer research. And, I think this is something that needed to be done probably long ago. There are many needs out there. This is a great one of the leading causes of death in the country that is almost preventable. So thank you for what you're doing. I appreciate you being here, and have a great day.
All right. So as you can see, our champions, our members of Congress, are very important to us, and they are on the Hill with us. I'm not really sure Congressman Payne really needs an introduction, but Congressman Payne has been a congressman for the district for New Jersey. He's a native Newark resident, and I had the pleasure of meeting him in 2012. Since his first term, he has fought side by side with us, has recognized the importance and value of prevention. I'm truly honored to have worked with him. He's lent his staff to the Fight CRC team to pick their brain, to strategize, to figure out how can we get over the finish line as it relates to the colonoscopy loophole bill. I mean, he is truly just an amazing champion on the Hill. I can't say enough about how amazing you are. So thank you for being with us. He's always with us. But without further ado, come here.
Good morning. How are you? So, all right. That's right. So, being a member of Congress, I try to, make my schedule fit my sleep requirements. But you guys always show up right about the time I'm supposed to be rolling over and saying, 20 more minutes. No, it's really good to be here. It's really an honor and a privilege. And, I'm really proud to work with groups like Fight Colorectal Cancer, and also people like my counterpart, Charlie Dent, from Pennsylvania, who I'm really going to miss. He decided that he's had enough here. He's going to move on and do some other things, but he's really been a true partner on the other side of the aisle. This is a nonpartisan issue, as we know. In my work on the Hill and gathering signatures for the different pieces of legislation that I've proposed, and getting President Obama to sign proclamation each year making March Colorectal Cancer Awareness Month. I haven't been as lucky this year working with the administration, but we have been persistent, and hopefully before the month is over, we'll hear something, but I'm not holding my breath. And I started not to because of the tension that my party is having with the administration. But in talking to my staff and other people, we all agreed that it was bigger than that, And so we made the effort to get the proclamation signed again, but have not been successful. But that's not going to stop us, right? We're going to keep moving, right? We're going to move in the right direction, right? We don't need any proclamation. We don't need no stinking proclamation. And you know, all of you know, colorectal cancer is really both preventable and treatable. And if caught early, you know, in screening, it really can prevent you having to go through this dreadful, dreadful disease. I know there are many survivors in the room. I'm glad you're here. We really look forward to this gathering every year. This is really great. You energize me, and what makes me continue to work as hard as I can. We didn't get to 80 by 18, but we moved the needle, and so that's what's important. We're headed in the right direction, and we're not going to give up, right? Right. All right. So I just, you know, really like to thank you know, you for being here, and Congressman Dent for being such a great partner. And you know, we worked on a bill together that would reduce the cost for colorectal cancer screening. You know, my father, Donald Payne, was the congressman prior to me. I succeeded my father in Congress, but he succumbed to colorectal cancer, which brought me into this fight. And so, you know, I have continued to work on this issue. I'm not going anywhere. I'm going to be with you until we get to the goal of making sure that we can eradicate this dreadful disease. So I'm just delighted that I have two pieces of legislation, the reduced barriers with Congressman Dent, and then we have the Donald Payne screening bill that is going through Ways and Means, and I've been able to elicit the help of several Republicans on the other side to get a CBO score, which is difficult. So they have lent their hand to that, and we should be getting there. You know, 2012 was when my father passed, and I had not been screened up until that point, and I was already over 50. And probably had he not succumbed to the disease, I might not have still been screened. But the first time I was screened, I had 13 polyps. And, you know, luckily, you know, none were cancerous. And, you know, it was really an eye-opening experience. And, you know, but I look forward to my colonoscopy every year now. I do it for my birthday, and you know. I mean, listen, you go in, they give you that crazy juice, and you fall asleep, you wake up, they give you apple juice and graham crackers. That's a good day, you know? So, I continue to try to get the word out. But let me just say to you, I am so proud that you appreciate the work that I do. You make, like I said, you energize me. You make me feel good about what I'm doing. You make me know that I'm doing the right thing. So let's keep it up. Let's continue to fight. Let's get it going. All right. Take care. All right.
I love that it's automatic for him to do the strong arm. So next we have Congressman Charlie Dent. He was sworn in 2005 and has worked tirelessly on behalf of the colorectal cancer community. And today we're really honored to have him with us. This is his last term in Congress. And before he leaves, we as a community really want to thank him for his service, his commitment to colorectal cancer, and honestly just want him to know how much we appreciate that you have fought for legislation to help improve access to colorectal cancer screening. So we are honoring him this morning with the Legacy of Service Award. Thank you.
Thank you. That's very kind. Thank you. I truly appreciate the honor and the award, but you're really the ones who deserve all the recognition for what you're doing to advocate for those who struggled with colorectal cancer. And I just wanted to say to my friend Don Payne, he obviously he lost his father. It was very painful. I lost my brother-in-law in 2010, my sister's husband, at the age of 46 to colon cancer. He didn't realize he had a family history, and of course, I was screened at the age of 50, but I did want to say one thing. You mentioned about colonoscopies. Well, I gave myself my 50th birthday present, too, a few years ago. And I was once asked on a television show, they said, Congressman, do you realize that congressional approval ratings are below 11%? The only thing less than, that's scoring less than 11% are cockroaches, mosquitoes, and colonoscopies. And I said, well, I had a colonoscopy once. It really wasn't that bad. and so I don't know what else you say. But I seriously, I do want to thank you all for this wonderful recognition. I want to thank you for the advocacy that you're providing for those struggling. I told you about my brother-in-law's situation. There's so many people in my community. I don't know is Mary Diacon here today? I don't see her here, but she's been down every year. Lost her daughter, I think, at the tender age of 18. To colon cancer. And so many people we know have been touched. Congressman Payne, Congressman Lance lost his mother from New Jersey. He lost his mother, I think, at the age of 11, at a very young age, he and his twin brother. And so there are many of us who've been impacted. We have introduced legislation, Congressman Payne and I and others, on the colorectal screening bill, where we have this hiccup in the law where if you get your if you're on Medicare and you get a colorectal screening, they'll pay you. You get the copay paid under Medicare. Excuse me, in your insurance under Obamacare. They'll pay for your screening, but if they discover a polyp, they won't pay the copay on the removal of the polyp. So there's a disincentive here. It's something we've got to fix. Medicare and other private plans all pay for this, but not under the ACA, so we've got to get that repaired. And there are other issues that we should be addressing, too. One bright spot, since you're here today, and this is timely, we will be releasing the omnibus appropriations bill imminently. Should have been today, but it hasn't happened yet. But we'll be releasing it. The National Institutes of Health will be receiving a very robust increase of $3 billion. That's a lot of money, and so... That's a big deal, and that marks the third year in a row we've gone up. I guess that would be $7 billion from a few years ago. We were at $30 billion, we went to 32, to 34, and now to 37. So this is going to be remarkable. So when you go into the offices today, make sure tell the members to vote for the omnibus appropriations bill because that NIH increase, if for no other reason. So with that, I just wanted to thank you again for this wonderful award. Thank you for your advocacy. Thank you to Congressman Payne, who's been a great champion, as you know. And with that, go attack the Hill. All right.
I
have my blue, too.
I know.
Thank you so much.
All right. 1 second. So, as Hill briefings go, we go with the flow, and members will arrive when members arrive, and they do, and it's worth the wait. So we are going to have our first speaker join us this morning, and we're just going to kind of have a congressman, have a speaker, and then we'll go with this. But one thing I do want to mention, this is such an important partnership, and the reason why we have our expert speakers join us is that really, and I think you've seen over the last 2 days, it really takes so many people to be working on this issue, and we have so many wonderful experts that are really focused on this year-round. So I'd like to bring up, I feel like they're all waiting to see who I'm bringing up. So, and I'd like to bring up Lisa Richardson. She is the director of the CDC's Cancer Prevention Program. She provides the leadership and direction at the CDC. And really, as we talked about yesterday, the Cancer Prevention Program is so critically important, and Lisa leads the charge there. So thank you for being with us.
So I'll say I've never, ever been in a room with this much enthusiasm this early in the morning. So, nor have I ever spoken to a standing room only crowd. So thank you very much. And so I'd just like to start out by thanking everyone for the invitation to come today. As we heard from the congressman earlier, colon cancer really does affect everyone one at a time. And so my own story is my aunt, who was like 55. Died of metastatic colon cancer, and very similar to one story that was told. It was like, a couple months, she had diagnosed with cancer, a couple months later, she passed away. So this is a really important issue to me personally, as well as professionally. I'm an oncologist as well, so I've seen the progress that has been made in colon cancer treatment. But today we're here to talk about screening. So what we do at CDC is we collect a lot of data, and we try to put it in a form that you all can understand. So when people are talking about how many people were diagnosed with colon cancer, that's CDC that collects a lot of that data. And so in 2014, there were 11,000 fewer cancers diagnosed than in 2000. And a lot of that was due to colorectal cancer screening, which is what we do at CDC prevention. It's not just screening, it's lifestyle choices as well. That one's a little bit tougher than screening. We were talking about that earlier. But currently, the screening rate is about 67%. From 2014 to 2015, that represents about 3.3 million people. So as someone said, we made progress, and the progress really is one person at a time. And we're not going to solve the problem, all of a sudden, everything's going to be better. But that we can't do this alone at CDC. We partner with other federal agencies, primarily federally qualified health centers, primary care associations and state cancer coalitions that we fund as well, especially our colon cancer work groups, the NCI, the ACS, the Health Services Resources Administration that funds those clinics that we work in. So our early success has been quite good. We have 30 grantees in the states, some universities, and the increase in screening within those clinics when we implement those things we know that work has been about 4.4% in those clinics, which represents about 24,000 people. So over that first year of the program, 24,000 more people were screened because we were in those clinics, in those health systems. So that, I think, was a very good thing. But, and there's always a but, right? There are 23 million people who've never been screened for cancer, colorectal cancer, who are within the age group that is recommended for. Exactly, and so I heard that, and so exactly, how do we do that? Everyone has said, as I said, there's more work to be done. We at CDC build those tools. We help the research that's done in the NIH and NCI get out into the community where it can benefit everyone. We also do awareness campaigns, Screen for Life. We have some new materials that have just come out, some videos, cartoonish. We're trying to move with the flow of the 21st century, but videos and cartoons seem to grab people's attention, so we have some really nice ones there. But we know that there are people we all know who are eligible to be screened who have not. And so one thing I'd like to end with here is that one thing I like to say about myself at CDC is I've never had an original idea or thought. Every time I have one, I go look it up. It's already been done, and which is a good thing, by the way, because then you can just do it better or, extend. But James Allison had a paper in 2010 that he published. It was a commentary that said, we said the best test is the one that gets done, colorectal cancer screening test, lots of choices. But Dr. Allison said the best screening test for colorectal cancer is the one that gets done well. And so, I looked at it, was 2010, we did it in 2013. I was like, well, okay, we're actually pretty smart at CDC as well. We didn't have an original thought, but, it was a great thing to do. And as has been said multiple times, you guys are the bomb. You're doing a great job. And, go out and, I won't say attack, but, go tell your people that colorectal cancer screening is extremely important and that we need to, keep going. Thank you.
And next, we have Congressman Lance from the 7th District in New Jersey. He joined Congressman Payne on our Fight CRC's Congressional Advisory Committee in 2015. And again, just an amazing champion for colorectal cancer. What I love about our Hill briefings is you get to see firsthand these champions on the Hill, and they just keep walking in, which is so exciting. So thank you, Congressman Lance. I know. These two are quite a duo.
Thank you. Good morning to you all. I understand this is the gold room. I think it's the blue room. I'm always honored to be with my close friend Congressman Payne. Our districts are adjacent, contiguous. In fact, we share one municipality, Union Township in Union County, New Jersey. Don says he has the better half of Union Township. I say I have the better half of Union Township, but we have worked together on quite a few issues, and you have no greater champion here on Capitol Hill than my friend Congressman Payne, ladies and gentlemen. Another champion, Congressman Dent, is retiring, and our districts are contiguous as well. I in northwestern New Jersey, and he across the Delaware River in Pennsylvania. I am annoyed, however, that Charlie Dent says that America starts in Pennsylvania. No, that's not accurate. It starts in New Jersey. Is that right, Congressman Payne? Let me say that you are the advocates who make sure that progress occurs. Every day we're making progress in this effort. The coalition on Capitol Hill is strong. It is bipartisan. And together we seek the results that the American people demand. To fight colorectal cancer, we want to make sure that every American has access to critical and life-saving cancer screenings. That means removing detrimental roadblocks that could keep a person from receiving the treatment he or she needs. More members of Congress are joining our ranks and adding their names as co-sponsors. But today, as you are on Capitol Hill, traversing Cannon and Longworth and Rayburn, please make sure that you ask members from across the country to sign on to our bill, H.R. 1017. We need everyone's help because the statistics are sobering, and sadly, each of us may have known heartache. I want you to know that I have been involved in this issue for as long as I've been in Congress, and before that, when I was in our state legislature, as a very young member of the lower house of the New Jersey legislature, a quarter of a century ago, I passed legislation to mandate that colorectal screenings be included as part of insurance policies. That is the law of New Jersey and has been for a quarter century. When we were debating that on the floor of the legislature, the insurance industry indicated that it was on the other side of the issue because it thought that patients in New Jersey might abuse a colonoscopy in overuse. I don't think that's I had one today and I want one tomorrow. I was in New Jersey. I was able, this is immodest to say, but I was able to overcome that argument on the floor of the New Jersey legislature, ladies and gentlemen. And if all our challenges were as easy as rebutting that, I think we'd be in we'd be in pretty good shape. Let me say that here in the Gold Room, I see a sea of blue as the sky is on the most beautiful summer day. Sunny summer days are ahead for all of us as together we fight this battle and we fight it to success. Thank you very much, ladies and gentlemen.
This is so exciting. So next we have Congressman Davis from Illinois, and I have to share this story because I think it's important for you all today. So I was wearing an I Heart Booty bracelet walking the halls of Congress, kind of helping folks get to their meetings and figuring things out. And then I saw this gentleman running by going, hey, you with the I Heart Booty, come to my office. And I was like, what is happening right now? So I quickly texted Candace Henley because I said, who is that? And what district is he from? And what's happening? I said, Candace, you follow me right now. We are going to this Congressman Davis's office, and we're going to get him on our Fight Colorectal Cancer Advisory Committee. And in 2015, he joined us, and he shared his personal story with us. And he and his family have been advocates for colorectal cancer. And we really appreciate you being here today. And thank you for stopping me in the hall.
Thank you so much. Thank you so much. She's absolutely 100% correct. I saw somebody wearing an I Heart Booty bracelet, and I, of course, like every member of Congress would say, come to my office. It takes you a while to get the joke, doesn't it? Even Coley Rector. Because I knew what I Heart Booty meant. You know why? Because my wife's a 19-year survivor. You know, I was just commenting out in the hallway. I'm like, you know, I never used to get a visit by the Fight Colorectal Cancer group that came out here. So it was into my second term in Congress when we ran into each other and we had the booty discussion. And immediately after our conversation later that day, I had a large group come into my office, and I got to tell the story of when my wife was 26. She couldn't walk a flight of stairs without getting winded. And being the supportive husband that I was to my wife and mother of our 2-year-old daughter, I said, well, honey, you know, the washer and dryer are in the basement. You're going to have to learn to walk the stairs. I said, maybe you ought to think about working out a little bit harder at the Y. Yes. What else would you say to somebody who's 26 and says, I'm getting winded walking stairs? No one thinks about colon cancer. No one, including her primary care physician, who told her, my wife, who's a nurse, mind you, that her physical illnesses were in her head. So my wife, being the persistent person that she is, she said to that primary care physician, why don't you run a CBC on me? Why don't we see if something's wrong? And they found her hemoglobin level was at 5.9. She then was diagnosed with a blood disorder, given transfusions, given injectable or given IV iron, which she didn't react too well to, given injectable iron shots, given iron pills. And every single thing that happened would eventually go back down to that low hemoglobin level, thus anemia. So they thought, we'll go in and do a colonoscopy and we'll find out that she's probably got Crohn's disease. Well, you know what? They found a tumor that was in her ascending colon, stage 2. We were able to get that tumor out, get it 6 months of chemotherapy, and even though 9 years later she was diagnosed with Lynch syndrome, that she's been cancer-free ever since. Well, we fired that primary care physician because we had the opportunity to be able to do that in this great country. Healthcare is personal to my wife and to me, obviously, and it's personal to everyone in this room. There are so many people wearing blue shirts that I know have your own stories like Shannon and I. So when I ran into you, it wasn't because I wanted more meetings in my office. Trust me, that's not what we need in Congress a lot of times is more things to do on our calendar. But this one's important to me. And after that meeting, my wife was your guest speaker at your nighttime event in 2015. And to be able to see her stand up on stage and tell her story instead of me, because, you know, we get paid to talk for a living. I talk a lot about it. She was able to go up there and relay this personal story to all of the ambassadors who were there that day and that week, and it really had an impact on her. So much so that she's usually embarrassed when there's a picture of herself, and she's embarrassed when she's the one who's standing up at the podium. But she had no hesitation when I told her I was going to frame her picture on the front cover of your magazine doing this in 2015 and hang it in my office. And I can tell you there's not a day that goes by that I have people come into my office. There's not a day that goes by and they don't ask me, who is that on your wall? And I say, that's my wife. She's a 19-year colon cancer survivor. And they, of course, say, when did she get it? When she was 12? I'm like, she would love to hear that. No, but she was 26. And the problem with the fight against colon cancer is we still have medical professionals that still today will tell those patients that their physical limitations and what they're feeling is in their head. And if we don't have your advocacy talking about the impact that colon cancer's had on you, and the survivors like my wife who were their own advocates to keep pushing and understanding, knowing something was wrong, that they needed that extra test, that extra assistance. And to be able for me to have that personal experience going through with a brand new, a 2-year-old, a dad, when you hear that word cancer, what do you immediately think about? You don't think about being able to grow up and see your daughter grow up and graduate high school and turn 21 a couple of weeks ago. And I will tell you, I know for sure that was the first alcohol her lips ever touched. Although she drank that first glass of wine pretty quickly. I never knew that would be what some first-time drinker does. But there was a time when my wife and I never thought that she'd be able to see that 21st birthday. But she did, because of our great medical advances, because of the advocacy of your organization and organizations like yours, even though it took you 2 years to find me. Wait a minute, I found you. I told you, it's all about the I Love Booty bracelets. So, and I've got one in my office too. But it's because you all are your best advocate. You all are the reasons why people like me, who now get the privilege to serve in Congress, and 19 years ago I never thought I would, but I get to advocate and co-sponsor all of the colorectal cancer screening bills. I get to talk about the importance of making sure that colonoscopies and colon screening are part of any health care plan. I make sure we get to talk about how we increase NIH funding when it comes to colon cancer research. And some may say, well, you know what? That's because you only care about your family, because your wife was diagnosed with Lynch syndrome. And you know darn well that it's going to impact not only my then 2-year-old daughter, but the blessings that we've had since my wife had colon cancer, our twin boys who are 17. And you damn right, I got a personal experience on this, you damn right, I'm going to fight for more NIH funding because it's going to benefit my family, but it's also because it's going to benefit millions of more families throughout this great nation, and many of you sitting in this room, because that's what I'm here for. I'm here to fight for the experiences that I know and in turn fight for the experiences that every one of you know, because that's our job. And I'm going to leave you with one other story. It kind of will be an anchor to the I Love Booty story that you guys finally took a while to get the joke. And trust me, my wife would have laughed at that one too. So we obviously, with the 2-year-old daughter, always thought we wanted to have more children. And, medical professionals, they're always so professional. They said, well, maybe with the chemotherapy that might not be in the cards. Well, God always has different plans. And my 2-year-old daughter had been telling us that you're going to have twins when she found out she was going to have a brother or a sister. So we took that lovely 2-year-old to the appointment to see the first sonogram. And I remember as a dad looking at that little picture, and the sonographer said, look for that heartbeat right here. And I'm staring at it. And all of a sudden, there's a pop, pop, pop. I'm like, yeah, I see it. And all of a sudden, the stenographer's down here. Pop, pop, pop. And she goes, there's the first heartbeat. And there's the second heartbeat. And being the understanding parent of a recently completed colon cancer regimen with 6 months of chemo of my lovely wife, I immediately said, oh my God, my baby's got 2 hearts. What did the chemo do? My wife immediately hit me and said, no, you moron, it's twins. And my daughter's playing with the toys on the floor, as any good 2-year-old would, and my wife said, hey, Torrin, we're having twins. And she looked up, she goes, I told you. Thank you. Thanks for what you're doing.
I think Congress knows we're here. I mean, we're probably the loudest Hill briefing on the Hill this morning. But so next, before we have our next member of Congress, join us, I'm going to bring up Dr. Mark Pochapin. He's the director of the Division of Gastroenterology at NYU. He's the vice president of the American College of Gastroenterology. The ACG has been a great partner to us, has partnered on the Hill for our Hill briefings every year. I think the association is very committed to colorectal cancer screening for obvious reasons, but Dr. Pochapin has been just a stellar leader in the country, raising awareness about colorectal cancer, and really has been so altruistic in his efforts and time. So thank you so much for being with us.
Wow. It's a tough crowd to follow. Let me tell you, as a physician, one of the greatest things we get to do is learn from our patients. William Osler, who's considered the father of modern medicine, used to say, listen to your patients, they'll tell you what's wrong with them. What a simple concept. How many of you talk to your patients? I sat next to a young woman, Violet, on the bus with me. She was telling her doctors in her 20s, I think she was diagnosed. Violet, where are you? Raise your hand. Where? Okay. Of course, she gets a shout out and she steps out. Point is, she was telling her doctor she knew she had cancer in her late 20s or early 30s, and the doctors kept trying to convince themselves and her that she didn't have cancer. And we really have to work together. This is a partnership. And the advocacy is one of the greatest components we have of moving the dial in healthcare. Colon cancer prevention, colon cancer treatment has been incredibly influenced by the voices, not by the physicians, but by the public, by the advocates, by people in the media. It has changed. And the things we hear from Washington are often not great, but what a great day today is. Today is a day where you guys are here making a difference, and you've already made a difference, and I want to share some of that with you. We know that colon cancer is one of the most preventable of all cancers that we have. It's also one of the most curable of all cancers. So here we have one of the most preventable, one of the most curable cancers remains the #2 cause of cancer-related death in this country. That paradox just shouldn't exist. But it's not going to change by physicians alone. Yes, we need to move the science, and we have to figure out what's causing this and why we're seeing it in younger people. But we have to do the things that are obvious, get people screened. And the only way we're going to do that is by changing the psyche of American healthcare. That's healthcare, not sick care. And you go to a doctor when you're well to prevent the disease. How do we change that? That screening has to be done when you're healthy, and that we have to talk about things that we don't like talking about, like colon and colon cancer. And the fact is, how many people are affected? We've heard our congressional leaders, how many of them have been personally affected by colon cancer? How many of us physicians have seen patients who have been misdiagnosed or delayed in diagnosis that's changed their outcome? But the good news is, the amazing news, is that the incidence and the mortality, the new cases and the death rate of colon cancer are dropping. In fact, I told you colon cancer is the #2 cause of cancer-related death. It's estimated that by 2020, it may be the #4 cause of cancer-related death. And we should have the ability to knock this off the list of top 10. We have to watch this thing drop. And here's the other good news, and this is good news for this country. I really feel proud to be part of a country that is focusing on screening and prevention, because the United States is one of the few, if not the only country, to have a plummeting incidence of colorectal cancer, meaning the number of new cases are being prevented because of all the screening, particularly with colonoscopy, finding the polyp, removing the polyp, preventing it from ever turning cancerous. Other countries have a lot of robust screening, and the incidence is actually going up because screening with other types of modalities are finding the cancer, and the mortality is dropping, the death rate. But in the United States, our incidence and our mortality are plummeting, and that's really all the advocacy that you guys are doing. People are really listening. We got to do better, yes, but people are listening, so congratulations for that. And we hear a lot about guidelines, and we have a lot of different guidelines, and we heard the best test is clearly the one that gets done and the one that gets done well. So we are making a commitment from the physician side of making sure that the quality of the screening, the quality of what you guys are advocating for is done in a way that people have the absolute best possible medical care that they could get. And the other thing that I'm committed to doing is making sure that physicians will not say it's in your head. We need to get everybody on board to listen to what Dr. Osler said, and listen to your patients. They'll tell you what's wrong with them. You guys need to be listened to. You've been speaking up. We have to listen. And it's not just our congressional leaders. It's not the public. It's our medical community as well. Why? Because we know that screening saves lives. So how are the three things we're going to do to guarantee that we try and get the message out? One, we have to get physician leadership to recommend screening, bring it up. They have to talk about family history. 30%, maybe even more, 40% of young people with colorectal cancer actually had a family history. It's possible it could have been picked up, genetically tested, whether it's Lynch or other. We have to talk about it. Physicians have to recommend it. Number two, we have to get our congressional leadership to make sure there are no barriers, so that we don't have barriers with legislation, with insurance, that we can get people screened. And number three, that's what comes back to you guys. We got to get the advocacy out there. You guys got to be stronger than ever. People have to listen to you because it's working. We're saving lives. We're saving lives together. For all of those survivors, for everybody who's ever known someone touched with this disease, we know what the value of one life, what one life means to so many people. Think about 200,000 that we can save by doing our screening. Think about the millions that we're affecting by trying to make sure that we prevent this disease. You guys are doing it. One life saved is saving the world, so let's go out and save the world. Thank you very much.
Well, we've had a lot of talk over the last couple of days about collaboration and partnership and working together. With regards to our advocacy, that truly is the backbone to what we're doing. We have to work together. The American Cancer Society, the American Cancer Society Action Network, both organizations are so critical to the fight against cancer. And so we're very honored that we have the opportunity to work with The American Cancer, I'm so sorry. I was like distracted by that. The American Cancer Society and the American Cancer Society's Action Network. Those are two really, really important organizations. So Dr. Rich Wender is the Chief Cancer Control Officer for ACS. He's here to talk about the goals of 80% and 80% goals beyond 2018. I've had the opportunity to see his leadership in action. We wouldn't be here as it relates to the 80% goal without his leadership. So I really appreciate you taking the time to be with us. Thank you. Sorry, I got distracted by the door.
Yeah. Thanks, Anjee. And thanks to all of you. I've joined you on every step of our Coast to Coast tour, and Mary mentioned LA, but we started in Arizona. So we're our Arizona gang who were there, and we started in Arizona, then LA, here we are in Washington, and I am thrilled to be here and to be a part of every step of our Coast to Coast spreading of the message to increase colorectal cancer screening. So let me tell you the story of 80 by 18. The National Colorectal Cancer Roundtable was started almost 20 years ago by the CDC and the American Cancer Society. We said we need to bring organizations together to increase colorectal cancer screening. In 2013, our steering committee said it's time to launch a big goal. And a doctor from Albany, Georgia, named Jim Hotz came up with this idea of saying, how about 80 by 18? It was very scientifically determined. We got modeling done, we got all this stuff. Turns out that it was the name of his uncle's bar that said it was called the, what was it called? The 818 bar. And he said 80 by 18 sounds good. So we did that. So, but you know, we knew it could be reached, and it's been validated, I will tell you that. And then in March of 2014, on a day infinitely worse than the one today. In fact, all the federal buildings were closed down, but that did not stop us from going to the National Press Club with the Assistant Secretary for Health, Howard Koh, with the leadership from the CDC, with myself from ACS and the Roundtable, and we officially launched this campaign, 80% by 2018, to achieve 80% colorectal cancer screening rates by the end of this year. Now, how are we doing? The worst thing you could possibly do in this crowd is argue with Congressman Donald Payne. So nobody tell him that I'm going to take him on right now, because he got up here and he said, well, we're not going to get to 80% by 2018. So I just want to point out a couple of things. This is March 2018. We get to the end of the year, 2018, and then we wait 2 years to see what the data shows. So let's see what we're going to do. Not only that, Dr. Richardson, my friend and colleague, already said 3.3 million additional people screened since we launched this thing. That was just 2014 to 2016. So we still have 2 more years of data to see how much further we got. And it's going to be quite substantial and significant. Not only that, here's maybe a better way to look at it. We haven't reached 80% unless you get your health care from the Veterans Administration, because the Veterans Administration is over 80%. We haven't reached 80% unless you get your health care from one of quite a number of plans, starting with the Kaiser plans in California. I don't know the total number, who are at 80%. We haven't reached 80% unless you get your health care from one of 26 federally qualified health centers that take care of the uninsured and low income. Community health centers, 26 who are at 80% colorectal cancer screening rates. So this can be done. It's being done by applying evidence-based interventions that we have summarized through the National Colorectal Cancer Roundtable and our over 100 partners. We had this idea in 2013 and 2014. We were going to get a few pledges. So we're going to go to the gastroenterology groups, get them to sign on as believing this. And I remember somebody said, maybe we can get 50 organizations to sign our pledge to hit 80%. We said, 50? How are we going to get 50? So today, We have over 1,600 organizations who have signed that pledge. That includes, that's not just healthcare organizations, that includes tiny little organizations like AT&T for their entire employee group, little organizations like UPS, who was with us in LA, with their 400,000 employees, and on and on and on. Hospitals, federally qualified health centers, et cetera, all who've done this. So we've gotten off the plateau. By the way, we also found out after we launched this thing that colorectal cancer screening rates had plateaued from 2010 to 2013. They'd stopped moving. We'd reached all the people who you just said, it's time for screening. They said, you sure? We go, we're sure. And they went out and got screened. We'd already done that. We launched this thing when we needed to really mount things. So I want to finish by saying one thing. So the VA, which is government-sponsored health care, over 80%. Anybody know where Medicare is? That's millions of people insured by Medicare. 78.4%. We are going to get Medicare to 80% when all the data are in. But you know what? There's a little obstacle standing in our way. An unexpected cost that people insured by Medicare might face if they're screened and a polyp is found. We need to eliminate that barrier. We need to push Medicare over 80% and get those needless obstacles out of the way, and you're the keys to doing that. I cannot tell you what a thrill and honor it has been to partner with Anjee, with everybody in this room. We're going to continue to do that, continue this effort, because as Mark said, how is this accomplished? It is not accomplished through big efforts. It's accomplished ultimately by one state at a time, one healthcare system at a time, one community health center at a time, one small hospital at a time, ultimately one person at a time. You are part of the people getting it done. Let's keep it going. We're going to hit 80%, and after we've done that, we're going to keep going. Going to get colorectal cancer screening rates as high as we can. I should mention, as Anjee said, trust me, gang, if you think we're stopping this effort at the end of 2018, guess again. We're going to keep going, keep pushing till as few people as possible ever have to hear the words, you have colorectal cancer. Thanks so much for everything you're doing.
Truly, we have amazing champions. We have members of Congress. We have our physician community. We have our public servants fighting with us, and the survivors in this room. I know you're going to do a great job today. It's going to be amazing. I want to make sure, just to double check, is Josh Perkins here? He is on his way. The truck is there. Okay, so Coast to Coast was an idea of driving prevention towards 80%. And so UPS did come on board. And what was super just amazing is that they put this prevention message of getting screened for colorectal cancer on their trucks. And so we were able to permit a UPS truck, which will be on the corner of... So I'm encouraging everyone to go. I know it's raining. It's not the most beautiful shining day, but in our hearts it is. So please go and check out the UPS truck because they covered it in blue. There's a message on it. It's a great place for a selfie, a strong arm selfie. So I'm just saying. But someone else who's driving that message is Scott Lagasse. And I know you got to meet him yesterday, but I feel like at a Hill briefing like this, we need a survivor to kick us off and to remind us we're in this fight together. So I've asked him to just share a few words and get us revved up before we hit the hill.
Those are tough acts to follow. I'm Mr. Social Media for colorectal cancer, by the way. I feel like we're best friends now through social media, and we just met for the first time this morning officially. So thank you, really the congressman, but for me it's an honor to be here, to be a part of this. I know you keep looking at your phone and we're tight on time, so I'll be quick here. But so most of you have heard my story. I see a lot of what have become friends and almost family to me now, or family to me. And when I came here, I had this great thought, speech, story, my story, and again, most of you have heard that. But I came here tired. I came to D.C. tired of the fight, almost, personally. And I landed, I went to dinner with Chris Hansen. Him and I sat back, who is president of ACS CAN, and just kind of talked things through, talked about it a little bit. I got a little bit more reinvigorated about the fight because it's hard getting told no all the time, and it's a hard fight, and one that I feel like I just started. So I was a little bit down when I got here, and we had the nice dinner, and we talked about it a little bit, and I felt a little bit better. Okay, I'm getting a little bit more going here, and then I came and saw everyone. And it's what I needed. You guys pushed me to fight harder. You guys are who I am thankful to be a part of this club. And it's sad to say that. It's scary to say that, but don't you start, Candace. But the point I wanted to make today is thank you, because my family means the world to me. My friends do, and you guys have reinvigorated me, and I needed it. I needed this. I needed it about yearly. I need my colonoscopy now for the mental side there, but I look forward to March. So go fight the fight, and you are doing a lot, and I'm proud to be a part of this. Anjee, keep fighting it.
All right, guys. So proud of all of you. You are fighting courageously. Please remember that. Hit the hill. Ask them to do what you want them to do. You have your talking points. You're going to be amazing today. Wear your blue. Stop those members of Congress in the hallways, under the stairwells, wherever you need to do it. But just have a great day. Okay, guys?